Hi, I'm Dr. Padmaja Lokireddy. I'm hematology consultant and a transplant physician at Apollo Hospital, Jubilee Hills, Hyderabad. Today I'm going to talk about chronic myeloid leukemia, which is a type of a cancer, a blood cancer which happens on a long term. This is called chronic. The disease is a long lasting, which is not curable but treatable. So what is chronic myeloid leukemia? How do the patients present and what treatment they need to take and how long they need to take? What if they stop the treatment in the middle, what happens? Or if the complications arise, what do they do? What is the ultimate treatment if they relapse? And what are the different modalities of treatment we have? So let's look into chronic myeloid leukemia. This is a chronic, that means a long lasting blood cancer. How do they present? Most of the times patients are asymptomatic. They would have gone for a blood test, for a health checkup, and then noted to have a high white cell count. From there on, investigations have started and they've had a blood test for a specific mutation called a BCR-ABL in the blood and confirmed to have a chronic myeloid leukemia, which is a blood cancer. And once it's suspected and confirmed, they would also have a bone marrow test, that is bone marrow aspiration and biopsy, and some genetic tests to look at the chromosomal abnormality, and some PCR tests, that is looking at the molecular abnormality. So once you have confirmed, people generally start on the treatment to reduce the white cell count. It takes about a month for the white cells to come back to normal. After that, the blood test completely looks normal, but why should they need to continue to take tablets? Because what we see is only the tip of the iceberg. The disease is still there in the bone marrow, in the chromosomes, in the molecular abnormality, that is in the gene. And we need to eradicate the disease to quite a low level, otherwise it will come back again. So you will be started on a tablet called imatinib, and there are different formulations, different companies come up with that tablet, and that is a tablet you take it orally once a day, which has to be for life for now. Maybe in future the evidence will come where you can stop it after few years, but as of now we have to give it for life. This is the most important thing, because a lot of patients take it for about few years and then they tend to stop and they come back with a relapse where it is very difficult to treat them at that stage. There are patients who come with a different chronic, not just a chronic phase where the white cells are about 30,000, 40,000 or 80,000. They may come with a white cell count more than 4-5 lakhs with a very large spleen, or there is some abnormal cells like blasts in the blood smears. Those are called accelerated phase or a blast crisis, and these patients upfront are treated differently. So they could be given another generation of medications, not just the imatinib. There are other medicines like dasatinib, nilotinib. This could be started in the very beginning. Or if you are on the tablet and your blood counts become normal, we will be checking it every 3 months on the blood test. This is called a BCR-ABL PCR. You must be having this test regularly, and we will see if your levels are less than 0.00, we call it as you've achieved a major molecular remission. And our target of treatment is to attain a major molecular remission, that is to keep your PCR levels less than 0.00. And once you attain 18 months from the start of treatment, we would like to see this report. And when you are continuing further, we may decide to do a blood test every 6 months. And it is important to monitor this disease, because you may look normal, your blood test may look completely normal, but your PCR may start to raise. That is the time we have to change your tablets to a different one. If you fail to do this, you may end up having a major problems where the chronic disease can change into acute leukemia, and at that time the treatment may well be only bone marrow transplant. So to avoid this and to avoid mutations happening, it is important to take the tablets regularly and to check the blood periodically and follow the doctor's advice. It may sound very simple disease. It is easy to monitor, it is easy to control as long as you follow a periodic review and a blood test. That could just be every 3 months. Please do that.